First of all, excuse me, I have a little, not little, severe pharyngitis, so my voice is a little will be cracking. Bear with that. But before I start my talk, and I just wanted to give one this thing, just a few days back, I attended a GCP talk actually. In that, they told everything, about the regulatory issues, rights of patients and all, but not one word of right of the principal investigator. I really feel bad that we talk a lot about patient, but even the investigator is working hard on the trials, and there is absolutely nothing mentioned about the rights of this thing. So I think that's one thing we have to change if we have to have more trials and more people getting interested in trials. So just with that few words, I'll start the talk, and I've changed a little bit actually. Charitable hospitals, I've changed that to development of rural cancer facilities. Because it's not just the charitable hospital, but the cancer facilities in rural India that I'm going to talk about. So, everyone is seeing this data since morning. Actually, Amol Akde has put this on the various forums. So, we have more than 1.5 million cancer cases already being registered now. And with the increase in number of cases, it has been estimated that more than 2 million cancer cases will be there by 2026. And these are official figures. The unofficial figures may be much more than that. Very importantly, as we know, the Indian population, 35% of the Indian population is urban and 65% is rural. But as we all know, more than 90% of the cancer care facilities are in urban India, and hardly 10 you can count on your fingers the rural cancer facilities, comprehensive I'm saying, cancer facilities that are available. So, like again, this number put up by Amol since morning, that hardly 22% districts, 22% districts in India have cancer care facilities, and there are many districts like in Mumbai and metropolitan areas where there will be 10, 20, even 30 cancer care facilities. But in rural India, there is very few cancer care available. But we have to, actually, the other part of which I already told is that with the increase in number of cancer cases in India, the number of TCCs available in urban India is really increasing a lot. We have excellent, and we even get basically, the foreign tourists who come here for medical tourism to come here and take treatment for cancer. So we have excellent infrastructure, excellent cancer care facilities in the cities, in the metropolitan cities, but very few in rural India. And because of that, if you read the article published by Dr. Dixit from Tata Memorial Center regarding the mortality rates, though the incidence of cancer cases is very low in rural India, the mortality rates are much higher in rural India as compared to urban India. And very importantly, this is another thing which Dr. Badwe always keeps on mentioning. With the urbanization of rural India, now even the cancer cases in rural India are increasing for a tremendous reason. As we know, for the last 2 years, we have been having this Cancer Care Day, the theme of which is basically to make world aware to close the gap in cancer care. There are many gaps in cancer care, as we know. One is the logistics. That means the cancer care, available cancer care facilities as compared to the number of patients, at the same time available manpower as compared to the number of patients. So there's a big gap in that which has to be filled. Then there is the affordability gap, those who can afford versus those who cannot. And I think that Dr. Amol will be talking about it in the next talk. So that is another gap. But the third important gap, especially in low, mid, and middle income countries, including India, is the gap of cancer care facilities available in rural India as compared to the urban India. And I'm going to talk about this and my experience of working in the Walalkar Hospital, how we can try to close the gap.